The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We are here for the next episode of TMD Demystified. I am Tony Urbanek. Today's topic was generated by a recent patient that I saw that I will have an opportunity to explain later, who actually had temporomandibular joint symptoms for roughly 20 years. And after a thorough history and examination, went on to treatment. But part of my discussion with her was the fact that she really needed to be aware that one of the symptoms of TMD was a life-threatening symptom. And we'll talk about that in a minute. But that stimulated me to prepare the topic for today, usual Tuesday morning, which is entitled TMD Can Have Fatal Consequences. And then I'll explain. But it is true that temporomandibular joint disorder, it's a singular, it's not a bunch of disorders. It has a bunch of symptoms. And the TMD gurus want to make it complicated by making it a bunch of disorders where they can bring in psychologists and psychiatrists and physical therapists and drug therapists, etc., to treat symptoms, but it really is a single disorder. It's a disorder generated by inflammation within the temporomandibular joint. It's a single disorder. Inflammation creates all the symptoms, so it's best to treat the cause, inflammation within the temporomandibular joint, rather than just go off and call it a bunch of disorders which are related and connected to the symptoms. But enough of that. The topic for today, the title for today is TMD Can Have Fatal Consequences. And it is true. So let me explain. Actually, there are three categories of temporomandibular joint disorder that can have fatal consequences. The first category I've talked about before, and this episode, although I believe I have talked about each and every one of these issues before, in prior episodes, we're bringing it all together today under the umbrella of TMD can have fatal consequences. So there are actually three categories. The first category is the sequela of inflammation, that is the consequences of inflammation within this joint, or actually any joint, a nidus, a focus of inflammation within the joint, and the effect that has on chronic inflammation in distant organs and different parts of the body, which actually can have fatal consequences. So there's a lot of work, and again, this isn't my independent work that created this. There's been a lot of work which shows definitely that chronic inflammation of periodontal disease, that is chronic inflammation around the teeth, have significant effects on generating or exacerbating inflammatory response within the coronary arteries, within the lungs, within the pancreas, within the liver, and now there's work shown that chronic inflammation within the brain is associated with, I don't want to say responsible for yet, but there is credible scientific information which shows that Alzheimer's disease is associated with chronic inflammation within the brain. A lot of current work going in that. Wouldn't it be interesting to find out whether absolutely that is true, what parts of the brain, and if Alzheimer's could be decreased, controlled, or lessened in its prevalence by eliminating chronic inflammation in other parts of the body. But getting back to the dental profession and the dental sciences, a tremendous amount of work has been done and shown that periodontal disease, chronic inflammation, has profound effects on exacerbating, or don't want to limit it to creating, but exacerbating inflammation in the vessels associated with the heart, the lungs, pancreas, liver, and now brain. So we know that chronic inflammation within the coronary arteries has pretty much everything to do with creating myocardial infarction of the coronary arteries, and heart attack, which is what? It is a fatal consequence of occlusion of the coronary arteries. And certain lung diseases are associated with inflammatory response within the lungs. Diabetes is responsible carries from inflammatory response in the islets of Langerhans, decreasing insulin. You see, chronic inflammation, they teach us in the basic sciences in both dental school and medical school that, chronic inflammation has certain characteristics, and it is a basis on just about every kind of disease. So inflammatory response is associated with pretty much each and every kind of disease, whether it be long-term, short-term, sequela of chronic inflammation or of inflammation. And it is my opinion, now everything up to this time has been basically based on fact, science, scientific methods, scientific articles, but the next statement is going to be my opinion. I firmly believe that when we know everything we need to know about inflammation, that the solution for the different varieties of cancer will be elucidated. We'll figure out the solution for cancers when we know everything we need to know about inflammation. We know an awful lot about inflammation. One of my degrees is in cell biology and anatomy, and studying inflammatory response, cell biology response of inflammation. So TMD can have fatal consequences. The first category is chronic inflammation in the temporomandibular joint, just like chronic inflammation around the teeth. There is no difference between the nidus of chronic inflammation, the location of chronic inflammation, whether it be in the temporomandibular joint or around the roots of the teeth, can have the same kind of effect in distant parts of the body and distant organs. And as you know, certain diseases of the heart, of the lungs, of the liver, of the pancreas, and now of the brain can be and are fatal. So if you ignore the chronic inflammation within the temporomandibular joint and it is not adequately treated for a long period of time, you can deduce that that is having a negative effect on the distant organs within the body, which can precipitate a fatal episode. So it's a contributing factor. It is a contributing factor, and it needs to be addressed. The second category of fatal consequences of temporomandibular joint disorder is more localized than the general nature of chronic inflammation, and that is the list of different kinds of locking of the temporomandibular joint. The last symptom on the symptom list of that in my symptom list, well-accepted symptom list of temporomandibular joint symptoms is various kinds of joint locking. We'll go through these symptoms again. The symptoms of TMD are frequent and/or recurring headache, earache, jaw pain, neck pain, ringing in the ears, tinnitus, subjective hearing loss, feeling of fullness in the ears, dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and lastly, various kinds of jaw locking. Now, I'm not going to go through the entire litany of various kinds of jaw locking, but one of the most common symptoms is the inability to open your mouth. That can have to do with too much muscle tightness or a inability of the condyle to move forward because the disc is in the way, disc displacement. It can be associated with both muscle tightness and disc displacement. But the point is, whether it be due to one or the other, we have seen patients, and the patient who precipitated this episode could only open her mouth about 15 millimeters and had been unable to open her mouth for 15 millimeters or so for about 3 months. Now, you might think that my next statement is going to be, of course, if people can't eat, it is a fatal consequence. Well, just the opposite. After 50 years of doing oral and maxillofacial surgery reconstruction of many kinds, and people having various kinds of inability to open, whether it be induced by surgery, induced by wiring their maxilla to the mandible, wiring their teeth together, or whether it be to traumatic problems, I have found that no one actually has ever succumbed to not being able to take enough alimentation, enough food in to sustain life. Where there's a will, there's a way, and people will figure out a way to get enough into their mouth, whether it be even liquids, to sustain life. So that is not what I am about to say can be a fatal consequence of inability to open your mouth. The fatal consequences of this have actually occurred, and that is in cases of emergency, where, number one, you have a dental infection that needs to be fixed, either with draining the infection, taking out a tooth, but you have a significant dental infection and the practitioner can't get inside the mouth to do what is necessary. And of course, maxillofacial surgeons are trained if you have a big dental infection and you just have swelling of the jaw, of the neck, et cetera. We can drain the infection from the external aspects. But some types of infections are so acute and so fast developing that they can actually impinge on the airway, and the patient, unless immediate treatment can be given, take out the tooth, drain the abscess, they will succumb to the infection and succumb to the large swelling associated with that infection. The primary mover on that is called Ludwig's angina, which is swelling usually from a posterior mandibular tooth, which gets into the neck, which basically strangles the trachea and is fatal. It's a fatal disease unless treated immediately. And then less frequent but obvious problems are simple tooth extraction. If you get a dental infection and it's been 3 months since you can only open to 15 millimeters, there is no way a dental provider, whether it be an oral maxillofacial surgeon or a general dentist, to get in there and do what he needs to do, which can eventually end up with enough infection, one way or another, that can be fatal, either through to body sepsis or more likely to occlusion of the airway. Occlusion of the airway will do it very fast. Starting with inability to open because of what? TMD, temporomandibular joint disorder, generated by inflammation within the temporomandibular joint. This is not a good sign, not a good thing to happen. It can be fatal. And the third set of consequences is a little sensitive to discuss, but can be fatal. And that is, over my career, treating TMD both surgically and non-surgically, and precisely, specifically over the last 14 years, where I've limited my treatment of TMD to the non-surgical variety. I treated TMD for the first 36 years of my career surgically. And as you probably know, 14 years ago, I did some research. I decided that long-term surgical care of this problem is not the ultimate solution. There needed to be a better way, and I discovered a device and protocol that made the inflammation within the temporomandibular joint go away predictably, which was a much better treatment than surgery, and certainly much better than treating the symptoms. You're treating the cause. But in the past 14 years, I have had 3 patients who have sincerely shared with me, either at the beginning or throughout, at different points throughout their examination, consultation, and or treatment, that they had been contemplating suicide because they could not stand going through the rest of their life with the constant pain and symptoms associated with temporomandibular joint disorder, which no one through their experience in years, decades, most of them decades, 10, 20 years of repeated symptoms and repeated attempts for professional help, and no one could help them. And they were contemplating suicide. 3 patients. One of those patients actually agreed to talk about this in a video that we made. Not something that I like to even think about. Definitely very sensitive to talk about. And as both a dental doctor and a medical doctor, I'm well aware of the sensitivity of talking about this kind of topic. But 3 patients shared with me over the period of the last 14 years that they had been contemplating suicide. Fortunately, each one of them accepted treatment, and each one of them had the same response, and that was elimination of the pain that created their desire to proceed with suicide. Actually stunning. The first patient that I came across, I was stunned, and she was sincere, and she was so thankful when we relieved her of those painful symptoms. So just in summary, TMD can actually have fatal consequences, whether it be the consequences of the effect on systemic disease, negative effect on systemic diseases that can be fatal, or localized effects on the inability of a provider to get into the mouth to provide appropriate dental care. A good example of that is, anesthesiologists, if they have to put an endotracheal tube down, and I've had lots and lots of experience placing endotracheal tubes. Recently saw a video online, I believe it was on YouTube, of an anesthesiologist who was struggling to get an endotracheal tube down because the patient could not open fully, and actually sacrificed the anterior upper teeth so that he could get enough space in to get the laryngoscope in and placed properly so he could slide the tube down the trachea. That particular video did not specify that the patient had TMD, but it did specify the patient couldn't get open fully, which was the most likely cause of a patient not able to open fully is one or more variations of temporomandibular joint disorder. Closed lock, being locked completely or partially closed. And this was a video that I saw recently when I was preparing for this episode of an anesthesiologist who sacrificed the anterior teeth so he could get enough space to get the laryngoscope placed properly to get the endotracheal tube placed. And then the third category are patients who absolutely are at the end of their rope, literally, because they can't stand the pain associated with TMD, that up until they came into our office, no one could help them with. TMD can have fatal consequences. I hope I made the point. I hope that this sobers you up a little bit about dealing with these patients and having a tremendous amount of empathy for them. Admittedly, temporomandibular joint patients, as many patients are, they're not easy to deal with sometimes because they have been run around in circles, literally run around in circles from practitioner to practitioner, treatment to treatment, that have not been successful. And they can get very disenchanted with the medical dental system. I've seen that. And my response to you, the listener, is be empathetic with them, because actually they have been abused by our system, our medical dental system. We are responsible to make it go right for these people. And when they lose patience, you can, if you have some degree of empathy, you can see why. With that said, I would like to invite anyone who would like to learn how to use what we had to call the Urbanek device and protocol, because the patients wanted to call Save My Life device. That was the second most common recommendation from our patients when we did a patient survey. What should we call this device and protocol? The second most common was Save My Life device, which is actually very ironic for the title of our episode today. The most common one was Miracle device. Neither one of them I was willing to use, and so we call it the Urbanek device and protocol, patented, FDA cleared, now have an FDA approved good manufacturing practices laboratory who makes these devices. If you'd like to learn more about how to treat patients with this device, you can go to our website, www.urbanektmj.com. If you'd like to communicate with me personally, I'm available at tmjservices.net, TONY@tmjservices, plural.net. I'm happy to discuss it with you. And certainly I'm open for criticism or comment. But if you want to criticize, please bring your scientific information along with you, please, and we can have a professional discussion. No problem. Until next Tuesday, I hope you have a very successful week, and I hope if you treat TMJ patients, you can do so as successfully as we do here in Franklin, Brentwood, Tennessee. I am Tony Urbanek, and this is TMD Demystified.